Alirocumab is a new lipid-lowering agent, a fully human monoclonal antibody administered every 2 weeks by subcutaneous injection, for which 3 trials in the ODYSSEY series, Combo II, FH1 and 2 and ODYSSEY Long Term were reported at an ESC 2014 hotline session.
Well, we've seen across the different studies that this treatment of the sub-Q injection given for a year works. It's well tolerated and produces 50 to 60%, depending on the dosing, reductions in LDL cholesterol. It gives us great encouragement that these dramatic reductions in LDL will translate into reductions in cardiovascular events.
SIGNIFY is a large randomized study designed to evaluate the impact of heart rate reduction by Ivabradine in patients with stable coronary artery disease without clinical heart failure.
We found that reducing the heart rate with Ivabradine, using a high dose of Ivabradine and effectively reducing the heart rate, we had no effect in terms of cardiovascular death and non-fatal myocardial infarction. We had specifically expected to find a beneficial result in the patients with angina. And to our surprise, what we found was an increased incidence of the primary endpoint, that's cardiovascular death, non-fatal myocardial infarction, in the patients with angina. There's one definite conclusion, and that is that lowering heart rate in patients with coronary artery disease and without heart failure does not improve outcome, does not prevent the progression of coronary artery disease. You cannot do that by lowering heart rate.
Many drug interactions exist. Most of them are not important to consider and may actually have good effects, good therapeutic effects. Main message is be able to identify the rare patients who will have major adverse drug reactions due to drug-drug interactions, because these patients may die from drug-drug interactions. Elderly patients, polypharmacy, the kidney is a very important target, and bleeding complications. And final message, don't rely on your memory and access websites to look at the drug interactions with the patient in front of you.